The art of hair transplant restoration surgery on a black African American woman who has a receding hairline and temple on the side. This type of hair loss is a very unique, mostly prevalent and common among black African American women. It's a genetic hair loss pattern. Now you have to have the gene, and then the braiding and the tight braiding and those stuff doesn't help, and it accelerate the hair loss. But not every black woman will have hair loss from the braiding. You have to have genetic gene of this type of hair loss, and it become very susceptible and can be accelerated for the hair loss with the tight braiding. This type of hair loss with treatments such as Rogaine can help, but it's very minimal. They're going to give you more like peach fuzz hair, and then you use the medicine for the rest of your life. Or the other alternative treatment is the surgery. I always recommend medication first, and you try to treat with medication first, and if it doesn't help, then surgery. Surgery is a more effective way, and surgery we take the hair from the back and put it toward the front, but we do it in a way where artistically and aesthetically it looks natural. As you know, I'm one of the very few hair transplant surgeons who specialize in the art of restoring black woman hairline and black man hairline as well. The curly hair is very difficult to work with, and you got to make sure you find someone who specializes in the working with black African curly hair, otherwise it won't grow out well. And you got to find someone who specializes in the artistry of it, because otherwise the hairline will look very abnormal. On average, from the mid-eyebrow to the hairline is around 4.5 to 6 centimeters for a woman. On average, and this client is around 5.5 centimeters, 5.5. And that's her natural. It's a great thing, we don't have to change it. And if you look sideways, see, that's where her hair loss is quite a bit further back. So, and you see the angle for men, the angle of the temple is pointed backward, most acute for Caucasian men, Asian men less, black men is perpendicular, but for women, it pointed toward the middle. The angle of the temple began for men where the eyebrows end, you put a finger breadth, that's where it begins, where the temple is. But for women, where the eyebrows end, the temple should start around there, and then angle forward. So there's a whole artistry behind restoring hairline for black. And then once you get the shape down, then you transplant at a very precise angle, starting around 35, 45 for Asian men, Caucasian men. Or black men, it's 15 degrees or less because it hugs their skin. For women, black women, a lot of times it's actually flat pointed backward and come backward and flare out. And the selection of hair grafts is important. We transplant rows and rows of single hair grafts in the front, followed by regular 2 hair, 3 hair, 4 hair in the back for bulk and volume. This is the art of hair transplant on black woman. Thank you.